everyone, today I am giving you information on the topic blindness. This one is the blindness part 2. Here we'll discuss about the blindness at the global level as well as the in India. So let's move to the next one, challenges for avoidable blindness in India. Now the different kinds of blindness are there. Some of them are avoidable, which we can prevent or which can be avoided. Okay, so first one is the cataract and the second one is the refractive error. Cataract is basically a clouding of lens in the eye that affects the vision. As one person grows in age after the 45 or the 50, as the person grows in age, the cataracts start developing in the eye. The natural lens becomes cloudy in the patient's eye and decreases the vision. As the lens gets cloudy, then there is a cloudiness or the blurriness of a vision is noticed by the patient. That is the development of the cataract. Different stages of the cataracts are there and the different types of the cataracts are there. When the cataract becomes mature in its age or it gets fully developed, then the patient is not be able to see anything. Okay, this leads to the blindness in case of patient's eye. So this was the journey of the cataract which convert a person into a blind person. Okay, next one is the refractive error. We have the three kinds of refractive error. First one is the myopia, second one is the hypermetropia, and the third one is the astigmatism. These, for example, a person have the myopia, which means a person have the minus power, or a person have the plus power, or a person have the cylindrical power. If the power of a spectacle is not given to a person at the proper time, then what will happen? The patient become amblyopic, which means the patient is not be able to patient have the two eyes. Okay, so the better eye will always work and the another eye will be converted into a lazy eye. Okay, so after as this condition will goes in its age or the this condition will continues in the patient's life, then patient will in future considered as a one-eyed patient. Okay, so if that one eye will move into any kind of threat, then it leads to the blindness of a person. Okay, so these are the refractive errors. So it becomes very important for a person, if he or she have the refractive error, then he or she have to wear the spectacle or do the proper care of that eyes in daily life or lifelong. Categories of visual impairment. Now the visual impairment means loss of a vision. Okay, so what are the categories of the visual impairment? Visual impairment is divided into 5 different categories at the level of visual acuity. Okay, visual acuity is measured at the Snellen's chart. Normal vision of a person is considered to be as from the 618 to the 66. Okay, let's move to the Snellen's chart. This one is the Snellen's chart. Okay, so let's see. First one is the 660, this one is the 636, this one is the 624, this one is the 618, this is the 612, this is the 69, and this one is the 66. Okay, normal person's visual acuity is 66. Let's see. Normal vision is from the 618 to the 66. Low vision in the first category is less than 618 to the 660. Okay, so the low vision is considered to be 618 to the 660. This one is the low vision category part 1. Next one is low vision category part 2 is 660 to 3 by 60. 3 by 60 is the finger counting at the distance of 3 meters to the 660. Okay, third category is less than 360, which was finger counting at the distance of 3 meter to the finger counting at the distance of 1 meter. We'll ask the patient to count the fingers and we will changing the distance at the 1 meter, 2 meter, 3 meter. So in this way, this one is the category number 1, 2 as well as the 3. Okay, in case of 3, the person will moves into the blindness. Okay, first one 66 to 618 is the normal vision. At the low vision there are two categories, 618 to 660, and the low vision category number 2 is less than 660 to 3 by 60, which means at the finger counting 3 meters. Next one is the blindness, which is less than finger counting 3 meter to the finger counting 1 meter, and the visual field between 5 degree to 10 degree. Visual field means field vision, side vision, or the peripheral vision is 5 degree to 10 degree only. At the category number 4 of the blindness is that which is less than finger counting 1 meter to the light perception. We will shine a torch at the patient eye and ask the patient, is the light visible or not from the different directions, upside, downside, left side as well as right side. Okay, So it will be less than finger counting 1 meter to the light perception, and visual field is less than 5 degree. So the peripheral field is less than 5 degree. Okay. Next one, category number 5 of the blindness is no light perception. Patient will not be able to respond is the light visible or not. There should be no visibility of light in case of category number 5 of the blindness. So these are the different categories of the visual impairment. Let's move to the next, avoidable blindness. The concept of avoidable blindness includes two things. First one is the preventable blindness and the second one is the curable blindness. We have two blindness. Okay, let's see one by one. What is preventable blindness? Preventable blindness is that blindness which can easily be prevented by attacking the causative factor at an appropriate time, which means when we can treat at the appropriate time, then it can be preventable. But after that time period, if we are trying to curing it, then it will not cure, it will be converted into a blindness. At that time it was preventable blindness, but after that time it converted into a blindness, not a preventable blindness. Okay, for example, corneal blindness due to vitamin A deficiency. Now if you see here that this one is the cornea, and cornea becomes always transparent, because when the cornea is transparent, first of all light will move to the cornea, then passes through the pupil, then lens, then strikes on the retina, and then image will form. Okay, so here if you can notice, this one is the right eye and this one is the left eye. The transparency has gone. Okay, there is no transparent, there is opacity. Okay, so the transparency of the cornea gets finished due to the vitamin A deficiency, and the trachoma can be prevented by timely measures. Now the trachoma is the another eye condition which has the different stages. Now first one is, this one is the normal eye. Okay, and if you can see in this, that there are small white colored dots are present here. Okay, there is an inflammation at the lid. When we invert the lid, then after everging of the lid, there are some white spots are there. Okay, those white spots get converted into a big spots, and eyelids carrying will be there, or these get converted into a different lines, and eyelids carrying in is there. When the patient close or opens the eye, then it will scar, or it will affect the cornea. After it affects the cornea, then cornea gets cloudy. Okay, in this way there is a progression of trachoma, and trachoma can leads to be a reason of the blindness, but it is a reason of preventable blindness. Okay, because it can be preventable when it treated with the time. If it is not treated with the time, then it get converted into a blindness, and the person become blind for a lifetime. Next one is the curable blindness. Now curable blindness is that in which the vision is restored by timely intervention. In this case, the vision loss comes back. Okay, for example, the cataract blindness can be cured by surgical treatment. Okay, if a person have the cataract, then we will remove the cataractous lens from the patient's eye and insert a new lens inside the patient eye. That vision loss which was due to the natural lens or due to the clouding of the natural lens will get restored by placing a new lens at that place. In this way we will cure the curable blindness. Okay, now if you can see here that this one is the cataractous lens. Okay, after removing the cataractous lens, the eye get converted into this. Okay, this black part should be there. Light easily moves to the pupil, then passes through the lens, and then strikes on the retina, and the image will form. But in this case, light will stops at here, it will not move to the further parts, because this acts like a wall and it will not allow the light to move on the other parts of the eye. Okay, this was the end. Thanks for your patience listening.